Hello and welcome to another Top Doctors online interview with one of our leading consultants. Today, we are so pleased to be joined by leading breast surgeon, Miss Fiona MacNeill. Miss MacNeill, thank you so much for taking the time to speak with us today. Would you like to introduce yourself?
Thank you very much, Lauren. As always, it's a great pleasure to do these podcasts, which I hope have been very informative to women. I'm Fiona MacNeill and I'm a breast surgeon. Thank you very much, Lauren.
No problem at all. So today we're going to be speaking about breast pain, particularly in young women, which is something that is very common. It affects a lot of young women. So I suppose the best place to start is, what is the most common cause of breast pain in young women?
Yes, thank you, Lauren. You're correct. Breast pain is one of the most common reasons that we see women in our breast clinics. And I think it's sometimes a puzzle to young women why they're seeing a breast surgeon. We can perhaps talk about that a bit later on, because actually breast pain does not require surgery. But that's for historical reasons. Breast surgeons have always been very closely involved in the diagnosis of breast problems. And so that is why many women, when they have a breast problem, such as breast pain, get referred to a breast clinic that is often run by a breast surgeon. But you'll also find increasingly we have more and more excellent and fantastic advanced nurse practitioners and breast care nurses who are also running breast clinics, particularly breast pain clinics. So that's a little bit of a preamble just to explain why women are often referred to breast clinics and why they might see a surgeon. So coming back to your question, what's the most common cause of breast pain in young women? Well, the most common cause is due to fluctuations in a woman's natural hormonal cycle or menstrual cycle. Now, it doesn't mean that there are abnormalities in those fluctuations. It just represents the natural monthly fluctuation.
Perfect. Super. A question.
Yeah, so I think I'll just leave it at that. Can I just go back and add something? Are you able to cut and paste these?
I think it is possible. Look, if we'll make it work. Don't worry, we'll make it work. Absolutely.
So the most common cause of breast pain in young women is due to the natural fluctuations in her menstrual cycle. But there can be other causes of breast pain. So, for example, you can get a breast cyst, and breast cysts are pockets of fluid, and they can fluctuate. The amount of fluid in this little pocket can fluctuate with the hormonal cycle, so they can grow bigger and shrink, grow bigger and shrink, according to the amount of hormones are in your blood. And when these cysts grow larger, usually just before menstruation or before you have a bleed, they can get really painful and uncomfortable and give you a sort of a stretched, uncomfortable, bruised feeling in the breast.
Ooh.
You can also get breast pain, for example, when you're breastfeeding, because you can get an infection in the breast. That's called mastitis. And this is where bacteria get into the milk duct, usually from a woman's skin, from the mum's skin, or from the baby's mouth. And it gets into a milk duct and then sets up an infection in the breast. I would say those are the most common causes of breast pain: fluctuations in the menstrual cycle, in the hormonal menstrual cycle, breast cysts, and mastitis, infection of the breast. There are many other causes, but those are probably the most common cause.
Super, that's very interesting. I didn't know about, I'm sure most women are aware of the menstrual cycle, how that affects, but I wasn't aware of the possibility of cysts or from breastfeeding either. That's very interesting. If we move away from...
Yes, breast cysts are... Oh, sorry.
No, go ahead.
I was just going to say, Lauren, breast cysts are really common And in fact, they're not a disease, they're a condition of the breast, a bit like the way your hormonal cycle naturally fluctuates. Breast cysts are a condition. And if we look hard enough in most women's breasts, we'll find breast cysts. So they're incredibly common. Yeah.
Interesting. It's something that's probably not spoken about enough. Perfect. So if we move away from, I
Yes.
suppose, the internal causes, let's call them, are there any lifestyle factors which may result in breast pain?
Yes, that's a very good question, because a lot of women say, okay, I understand this pain is not caused by any disease, it's just caused by the natural working of my body. So what can I do about it? And that's where lifestyle factors might possibly be helpful. Some women who have a lot of breast cysts or have very large, heavy breasts find that if they do not wear a bra, the pain gets worse. Other women find wearing a very tight bra makes the pain worse. And I think this is where an individual woman has to work out what suits her the best. So if you've got lots of breast cysts, a tight bra may make your breast feel very compressed and sore. And some women find as their cysts get bigger or their breast pain gets worse before they menstruate, they have to move up a bra size. And therefore they're more comfortable in a slightly bigger bra for the second half of their cycle, for the last 10, 12 days of their cycle. But it's very individual. And I think a woman just has to experiment and find out what helps her. But I don't think going braless in itself would give you breast pain. But some women do find that wearing a bra helps their pain. Some women find that not wearing a bra helps their pain. So I think you just have to experiment for yourself.
Perfect.
I don't think sleeping positions make any great difference to breast pain. Once again, women who've got very heavy breasts or get a lot of pain towards the later half of their cycle before they menstruate, I think they find wearing a bra in bed at night time helpful, because as we all know, when you move around in bed, your breasts move. And so sometimes just keeping them encased in a bra can help with breast discomfort. Sometimes it's interesting, actually. Sometimes women say to me, I don't actually have pain, Fiona, I have discomfort. To call it pain is wrong. It's more of an awareness. I'm just aware of my breast, or it's just uncomfortable. It feels bruised. These are all the words that women use to me when they're trying to describe the type of pain or discomfort that they're experiencing. So yes, I don't think sleeping positions make any great difference, Lauren.
Okay, perfect. Thank you. It's very interesting. So it's not really a one size fits all.
No, you're right. It isn't. It's very individual. Now, there's an awful lot of stuff that's been written about other lifestyle factors that might cause breast pain. And I think, to be honest, the jury's out. So, for example, some people say if you drink a lot of caffeine, it causes fluid retention in the breast, and that gives you more pain. You know, I don't think the evidence behind that or the science behind that's very good, Lauren. Now, clearly, if you're drinking 10 cups of coffee a day, that's perhaps not good for your general health. And you should think about cutting down the amount of caffeine you're taking. But whether going on a caffeine-free diet helps with breast pain, I have to be honest, I'm a bit skeptical about that. But if you look in all of the self-help magazines, they always say drink less caffeine. So I think drinking less caffeine if you're taking 10 cups of coffee a day is probably a good idea, but whether it helps your breast pain, not sure. Other things, some people say that having too much dairy in your diet gives you more breast pain. Once again, I think the jury's a little bit out on that. What else can cause breast pain? Lifestyle factors. Well, one thing that women do mention a lot is that if they go running, that once again, it comes back to the bra wearing again, that if they don't wear a good supportive bra, then that can give them a lot of breast pain, and it can also give them chafing of the nipples. It's called jogger's nipple. It's a charming phrase. So once again, wearing a good supportive bra when you're taking high impact exercise is probably a good way of alleviating breast pain. Trying to limit the amount of breast pain you've got. Try to limit the amount of breast pain that you get. I can't think of any other particular lifestyle factors, Lauren, unless there's any others that you could particularly think of that you would like to ask me about.
Just having a think now, but I think you've covered them all. I think my take from that is the best thing you can do is like anywhere in your body, for example, your knee or your elbow, wrist, is to support it if you're feeling pain in it, to restrict or sorry, to support.
That's a very good analogy, Lauren. I like that. You're quite right.
Perfect, super. So the next question I have is, what are other common medical conditions that might result in breast pain?
Yes, I think the one thing that women are always scared about is breast pain caused by breast cancer that I can't see or feel in my breast. And actually, breast pain in itself, i.e., you have no other breast problems, such as a lump, is never caused by breast cancer. I absolutely understand why women think, well, could I have a small cancer in my breast that I can't see or feel, and that's what's causing my pain? And the answer is no. So I think that's a common fear. We've already talked about the fact that breast infection, mastitis, can cause breast pain. Other common medical conditions, there's some women get pain in their breast from their chest wall because your breasts lie on top of your chest wall, your muscles and bones. And actually the pain is coming from your chest wall through the breast. So you think it's your breast, but actually it's coming from your chest wall. So you can get pain from the shoulder girdle coming through the breast, or from the rib cage and the muscles overlying the rib cage. I think this tends to be more of an issue for older women.
Okay.
Sometimes you see women in their 60s and 70s who are no longer having a menstrual cycle, and they start to get pain in their breasts. That's sometimes related to arthritis in the chest wall and the spine, and the pain from trapped nerves is radiating around and they feel it in their breasts.
Very interesting.
Yes, and sometimes older women, of course, if they get breast pain, the first thing they will think about is breast cancer. But the type of pain that they tend to get tends to be at the side of their breast, and it's due to the rib cage just slowly collapsing down as their spines collapse down as they become a bit osteoporotic as they get a little older. Another condition that can give you pain in the breast, and some women describe this very graphically, is they feel like somebody's sticking needles in through their nipples, which sounds horrible. And that can be in younger women, but also it can be in older women as well, who've passed the menopause. And this is pain from the milk ducts behind the nipple. And women can get a condition of swollen milk ducts. It's called duct ectasia. And it's just where the milk ducts become a bit swollen and they become filled with sort of debris that collect in there over the years, and this can give this discomfort or this feeling of pain behind the nipples, and it feels, women say, like needles being put in their nipples. It's very distinctive when women tell me this, because I know straight away what it is, and once again it's not related to breast cancer. So those are probably the most common other conditions that can result in breast pain. But as I said earlier, the most common reason for breast pain is just the natural fluctuations in a woman's menstrual cycle. Okay,
super. I'm going to go back to that point that she made. Would that only occur in women who have lactated before, or can it affect any woman?
Yes, that's a really good question, Lauren. Interestingly, I find, I've been looking after women now for 25 years and just listening to what they say and hearing what they tell me in the consultation. It seems to be that you see younger women with breast pain in their sort of late teens, early 20s. And then I don't see women for a little while, and then they seem to come back again in their mid 30s. And then I don't see them again for a while, and then they come back in their late 40s, early 50s. And I think the reason we see these peaks of women coming in their late teens, early 20s, mid 30s, and then late 40s actually corresponds to the time of great change in a woman's body clock. And in your late teens, your breasts are developing. In your mid 30s, your breasts are starting to change as your body clock changes. And then in your late 40s, your body clock's really changing and preparing you for the menopause. And this is where you see these peaks of pain or discomfort. Now, something that a lot of my women tell me they were never aware of when I talk to them is that unless a woman has had a pregnancy and breastfed, her breasts have never fully developed internally, physiologically, or functionally. So they may look fully developed, and to all intents and purposes from the outside, they're not fully developed. But internally, they've never fully developed. And it's interesting, you see lots of younger women who have breast pain, and then when they get pregnant and breastfeed, their breast pain settles down. And I'm never very sure, if I'm honest, is whether they're so distracted by having a young child or all of the, how shall I put it? Yes, all of the distractions that go with running a young family. You just, your breast pain seems like a small thing in amongst everything else, but it is very noticeable that once a woman's breasts have fully developed, she doesn't seem to experience as much pain as a woman whose breasts have never fully developed because she's never had a pregnancy or breastfed. This is an area I think that's never really been fully studied in large observational studies. It's fascinating though, isn't it?
That's exactly the word I was going to use. It is so fascinating. I've never knew that. I never ever heard that before.
And this is just my observation over years of practice. And I do say to ladies, I'm not telling you to go out and get pregnant to sort out your breast pain. That is not what I'm suggesting, because actually getting pregnant and breastfeeding causes lots of breast pain because your breast becomes so swollen. But it's just fascinating, isn't it?
Absolutely. It really is interesting. So the next point I want to ask is there a way to manage breast pain? I suppose there's many different causes of breast pain. So is there different ways to manage it?
Yes, once again, another excellent question, Lauren. You've thought about these very carefully. You're right. There are many different causes of breast pain. So that's generally why a woman needs to see her GP, come to a specialist breast clinic, see a nurse practitioner, whatever, to understand why she might have breast pain. So then she can learn how to manage it. So obviously, if you're breastfeeding and you've got a breast infection and mastitis, then you might need antibiotics. But it does come back to the fact that the most common cause of breast pain are these natural fluctuations in your hormonal cycle. And obviously, that's not a disease process. So there isn't really any treatment as such, because it's a natural working of your body and it's not a disease. There isn't any specific treatment. So if you have very severe pain, however, I find most women just feel reassured speaking about it and understanding why they might have breast pain and that there's nothing unusual or abnormal about it. And then most women feel that they can manage it and cope with it once they've been informed and educated. But some women do get very severe breast pain, and it starts to dominate their life when it's very severe. And it may dominate 2 or 3 weeks of their life, and they only have a week where they're pain-free, and that's the week they're menstruating. And now that is much more difficult. And how do you manage that? Well, it comes back, I think, to managing the symptoms, wearing a bra that's supportive, trying to understand it's not caused by disease. We're very reluctant to give women drugs, medication to help this type of pain. And the honest answer is there aren't many drugs or medication to help this type of pain. I mean, you can alter a woman's hormonal cycle, which can help the pain, but that's incredibly drastic. And that tends to have its own problems because you're giving medication, drugs that may have side effects. And in the past, there are a lot of drugs that we used to use to alter a woman's hormonal cycle. And now we no longer use them because we realize the side effects of these drugs far outweigh the benefits. So it's more about teaching and educating women how to manage their breast pain. Some women do find evening primrose oil can help breast pain. So for women who've got severe breast pain, I do say it might be something that they want to consider. I think if your breast pain is mild and it fluctuates with your cycle and you get a bit of soreness and discomfort for a few days before your period, I wouldn't take evening primrose oil.
Mm-hmm.
But for women who've got very severe pain, it might be something that they could consider. And how it works, I don't think we fully understand. There have been research studies done on evening primrose oil, and a little bit like I was saying about caffeine earlier on, the jury's out. The research studies are not very high quality, and they give slightly conflicting results. But about 3 out of 10 women say that they get benefit from taking evening primrose oil. A lot of people say, well, it's a placebo effect, but well, if you get severe breast pain and you're one of those 3 out of 10 women that gets benefit, does it matter it's a placebo effect? Probably not.
Mm-hmm.
So it's certainly something women can consider. I think the difficult problem with evening primrose oil is it's not a drug on prescription. You have to buy it in a Whole Foods shop, and it's expensive. And you have to take very high doses for about 3 months before you know whether it's going to benefit you. So when you look at the evening primrose oil packet, you have to look for the active ingredient, and that's gamma-lactic acid, GLA. So if you look on the back of the packet, the more GLA it contains, the more expensive it will be, but the more effective it's more likely to be. You sometimes have to take up to 6 capsules a day of evening primrose oil. So it's quite a commitment for a woman to do that. But if you've got severe breast pain, it may be something you're prepared to commit to for 3 months. So yeah, slightly long-winded explanation. Sorry, but you can see it's quite a detailed discussion to have with a woman if she wants to.
Of course, there seems to be many options.
Because it's not just sort of one pill you can pop.
Yeah. Exactly. And on mentioning the pill, can contraception be used in any way to manage hormones?
Yes, it can. And interestingly, some women find certain contraceptive pills make their breast pain worse, and some make their breast pain better. And it's a little bit like bra wearing. I've never been able to identify any particular type of contraceptive pill that helps breast pain. And as you know, there's a huge variety of contraceptive pills out there. Some are progestin only, some are a combined pill. And it may well be that it's the progestin-only pills that alleviate breast pain and the combined oral contraceptive pills that tend to give more breast pain, but I've never been able to tease that out. There might be somebody out there who knows a bit more about that than me, of course. But it can help. But once again, I think I wouldn't start the oral contraceptive pill to help breast pain, unless your breast pain is really troublesome, because, you know, the oral contraceptive pill has its own problems. It's great at preventing unwanted pregnancies. It does have other problems associated with it.
Absolutely.
So you just have to be a little cautious. And
Mhm.
it would have to be discussed in detail with your GP.
Super. Thank you for answering that. And when should one be worried about breast pain? At what point could it start to cause concern?
Yes, that's a very good question. When it's caused by the menstrual cycle, it's never of concern. But of course, how does a woman know that? And I think if you're concerned about your pain because it's persisting or getting worse, or if you notice that your breast has changed, so you've developed a lump, or it's gone red, or it just looks different, then actually I think you should just get it checked out by somebody else.
Perfect.
And a lot of women do come to me saying, you know, I'm pretty sure this is just my menstrual sort of pain that's just got a bit worse because I'm getting a bit older. But it's getting a little more persistent, and I'm starting to wake up in the middle of the night worrying about it. If that happens, do you know, you should just get yourself checked out. Don't worry about it.
Always better to get a second opinion, or to get a medical
Yes,
opinion.
I think so. Yeah, I think so. If you've got breast pain for the first time and you don't have redness, you don't have a lump,
Mhm.
and you think it's related to your menstrual cycle, then I would sit tight and just monitor it and see what happens. Because generally, if it's menstrual, you'll have it for 2 or 3 months, then it'll disappear, then it'll come back again for 2 or 3 months, and that tends to be how it plays itself out. But if it's worrying you, you know, just get it checked out. Nobody's going to say to you, don't waste my time checking your breasts. And I think that's a big concern to women. They say, oh, I think I might be wasting your time, doctor. And I would say, do you know, I'm delighted if you are.
That's a great response.
Well, you know, it's great to see healthy women and tell them they're healthy. And
Of
also,
course.
it's a great opportunity because I deal with a lot of women who are not healthy. And so it's actually very good to see women who are healthy. And it's a good opportunity to explain to women a little bit about their body and
Absolutely.
why they're experiencing this. And I think when a woman understands that breast pain is a little bit like period pain, it's just less obviously linked to your menstrual cycle than period pain, but it's a little bit like period pain. And I think when I explain that to women, it's like, oh, a little light bulb. They go, oh, yes, I understand now. And I think seeing them reassured is great.
Perfect. Super. So the last question is, when might surgical treatment for breast pain be necessary? But I think you started off with this by saying that surgery for breast pain isn't really necessary if it's just pain without a lump. Is that correct?
Correct.
Okay.
Pain on its own, Lauren, never requires surgery. And surgery causes pain, Lauren, I'm afraid. And so you would never do surgery just for breast pain. Some women have painful lumps. They're not cancerous. They're completely innocent. And they're called fibroadenomas or breast cysts. And some women do say, can you remove them to stop the pain? But the difficulty is you might remove that area and then you leave a scar and you leave pain from the surgery. And then a year later, you might get the pain in another area for the same reason. And in the past, some women would have 10 or 15 or 20 operations to remove these painful areas, leaving scarred, distorted breasts. So we just don't do that anymore, Lauren. Yeah.
Perfect. Well, super. Miss MacNeill, that's all the questions I have for you today.